Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, and I am joined again today by the amazing Jessianna Saville. Jessianna is the principal of Kidney Nutritional Institute in the US there, which is a group of renal dietitians, mindset coaches, and more that really specializing in digging into how to improve dietary interventions in improving kidney function and reducing chronic kidney disease. Jess is an amazing wealth of knowledge. She speaks to many doctors and nephrologists around the country over there. And she's just amazing. She's been on our channel so many times, and there's a reason for that. That's because Jess is an expert at what she does. So Jess, thank you again for joining me. I'm always grateful to have you on board and for you to share your knowledge with us. And we're digging into one of my favorite topics today. And I know one of yours, we like to get a little controversial about the importance of potassium in kidney disease and how it gets taken out by everything. And you were just telling me before we hit play of some amazing case studies that I definitely want to get into. But really, we're talking very specifically today about the role of potassium and magnesium in regulating blood pressure. And of course, we know that elevated blood pressure after diabetes is the second greatest cause of kidney disease. So let's get into it. What do we want to start? What do we want to say?
Well, okay. So first off, I'm going to give credit to my patients for inspiring this episode because it's weird as a clinician, you'll have kind of problems and outcomes clump together. I don't know why this happens. You'll have everyone have the same problem in a week and have all these different solutions. I'm glad it works out that way because you learn a lot. But I had two patients this last week that both commented on how important it was for them to have a high potassium intake to finally get their blood pressure to budge, right? And these are people that are super active. They hike, they lift weights, they eat this super good whole foods diet, and this one thing just kept dogging their heels, right? That they just couldn't get their blood pressure down. And they're just told by their doctors, hey, you have reduced kidney function, so that's why your blood pressure is off. And they wouldn't accept it. And so they dug into utilizing extra potassium to manage their blood pressure. And so to these patients, if they watch this, they'll know who they are. This is, for you, because we really want to share this story. I think potassium is so misunderstood, so demonized, as is its very important friend, magnesium. And it kind of comes back and kicks people in the butt. And they don't know, they can't figure out why there's this problem. They just keep getting RX more and more blood pressure meds, and it's actually a nutrient problem. So to the patients that inspire us and let us work on things and learn things, this is, for you too. So maybe let's just start
case studies. Yeah, let's start with the case studies. Because tell me exactly what happened, because people are what happened?
Yeah. So maybe let's just start a little bit with why potassium and magnesium are demonized.
Yeah, let's do
that.
Then
we can dig into just a little bit of technical stuff on what happens in the kidneys and what happens in our body with potassium and magnesium. And I'll probably default, especially to you on some of these, Fiona, because you always explain the pathways really well and I get all mixed up.
Okay.
So a couple of things here. So potassium, if you have zero kidney function, you don't pee anymore, you just don't have any kidney function, it is a classic symptom for many people to have their potassium go up, because as you'll learn here in a minute, the kidneys regulate a lot of our electrolyte balance, including potassium. So for a long time, the renal diet, right? People that are on this diet that have kidney disease, and it's usually on the internet, it's not quantified by are you early stage or no kidney function. They just say, if you have kidney disease, you have to watch potassium. So it has been perpetuated online in textbooks, in education, that people with renal disease need to be on a renal diet, and a renal diet is low in potassium to prevent hyperkalemia or excessively high potassium. Now, to be fair, hyperkalemia is dangerous. It can put you in the hospital. It can kill you. Yeah, you just overload your cells and you more or less stop all your nerves and all your muscles from working, including your heart. So hyperkalemia is very, very, very dangerous, very serious, but it is not so common for a lot of people as is thought. It's not like if you have kidney disease, you're automatically at risk for hyperkalemia. That's not true. If you have kidney disease, and maybe you don't have like any function, or maybe even have a blood pressure med that's bumping up your potassium, it might be an issue. You can know, so you feel safe in this conversation, just look in your labs, right? Where does your potassium level lie? If you are less than 5, you are for sure safe. And I'm using US labs, but if you're less than 5, you are for sure going to be just fine on potassium. So that's why potassium gets demonized. Magnesium is interesting because I remember even starting as a new dietitian in a dialysis center, and what we were just told is like, don't give magnesium. Magnesium is bad. If you don't have kidney function, then you shouldn't have any magnesium. Now, there's a couple, this science has evolved over time. Certainly, people that take excessive amounts of magnesium, it's hard for it to clear through the kidneys at later stages, and they could get a toxicity, but it's very, very uncommon. And you've seen the research evolve so that it doesn't, they're seeing that maybe there's not as big of a problem with magnesium as we thought for kidney disease. And personally, I think that overly restriction, it causes a lot of issues. Even like for my dialysis patients, be like, man, like they're getting leg cramps all the time. And they'd be like, oh, okay, well, let's do this, that, whatever. I'm like, I think it's just a magnesium deficiency. Like, can we just try a little bit? You know, you're not going to get a toxicity in like a week of, 400-600 milligrams. And some people that would try it, they would see those resolve. We need those electrolytes, potassium, magnesium, sodium, to be balanced so our muscles and our nerves can work. So magnesium's been demonized a long time, but these two very important electrolytes are like best friends. They play together and they help balance so much in our body, including our blood pressure.
Yeah. And to add to that, I was just reading a study before that often when you have elevated potassium in the urine, and again, I would say it's probably in the lower ends of elevated potassium. What happens is we go, you must go on a low potassium diet. What's interesting is that is a sign of magnesium deficiency. And that as soon as you take magnesium, because magnesium channels potassium back inside the cells. So what happens is that when you're getting potassium leached, it actually is a deficiency of potassium inside the cells because there's not enough magnesium that acts as a transporter to move it inside the cells. So it's an intracellular potassium deficiency with an extracellular magnesium deficiency. So when you have potassium in the urine, that's what's happening. You've got too much potassium outside the cells. That's why you're seeing it in the urine. Not enough magnesium, not enough magnesium outside to draw the potassium in. Yep. So potassium in the urine is a deficiency. When you supplement with magnesium, you'll suddenly see that the potassium in the urine will go down because there's enough magnesium to transport the potassium back inside the cells.
The cells where it can get used properly. Yeah.
And I can put the link to the study, and if you go and look at that, that's everywhere. That's not rocket science. I'm not making that up. So potassium in the urine is generally a magnesium deficiency, and an intracellular potassium deficiency. And intracellular potassium deficiency will guess what cause? Elevated blood pressure, cardiovascular arrhythmia, cardiovascular ischemia, and a whole pile of things like heart disease.
Yeah, no, it's like, they just go together. And even this particular channel in your kidney, right? It's called, I had to keep it up on my screen, the renal outer medullary potassium channel. It's called the ROMK channel, right? Renal outer medullary potassium channel. They use K because that's the, chemical signal. So the ROMK channel. Intracellular magnesium, what it does, like you're saying, right? When you have enough magnesium, then it actually opens up this channel pore, right? And then when that channel pore opens, suddenly you get more potassium in the urine. And then, like you said, right, if you're spilling potassium in your urine, you are not going to have enough for your cells to use. So like, this is like not just cells, it's like directly linked back to the kidneys and cells too. So it is really a really huge, important thing.
Yeah. Which is fascinating because it's the opposite of what everyone's told, right? That potentially, and it can go bidirectionally both ways, but potentially excess potassium in the urine is actually a sign of potassium deficiency, not potassium overload.
Yeah. exactly. So here's a couple of things that I see happening is that number one, a lot of people are magnesium deficient. I was trying to find the data point on it, and the like very conservative data points, like 20% of the population is magnesium deficient. I was like, no, it's way higher than that. But I can't find the data point. But a magnesium deficiency is very, very common for people to have. And so you think about this from like a kidney standpoint, right? And people are told, don't like A, don't take any magnesium, and B, like, let's restrict your diet a whole bunch. Some people that are, on a like super great plant-based diet, they get confused about like using nuts and seeds. And guess what? On a plant-based diet, you actually don't have tons of magnesium sources, like rich ones, outside of your nuts and seeds. So they've got a deficiency there, right? Or if you're using just a regular diet for magnesium, even then we find that like people just still don't get enough of the recommended amount. So people already are low, and then we have like soil quality and all these other things that link back to it. People are already low in magnesium with kidney disease, and then they hear, oh, and by the way, also, like, don't eat any foods that are high in potassium. So when their diet previously had some potassium-rich sources, and the typical Western diet is already poor in potassium, it already like just doesn't hardly have any. So people cut out like the little bit of potassium that they might have in their diet, their banana that they have sometimes, their potatoes, their sweet potatoes, or tomatoes, and now they don't have any potassium either. So not only do they not have enough magnesium, they don't have enough potassium, and it's really hard for our vascular system to respond well when it doesn't have either of those, right? You can't get potassium into the cell, and you don't have enough anyways. And so you're just like, you're stuck, right? And your blood pressure, you would have a really hard time with your blood vessels being able to dilate properly without either of those two nutrients. And you've kind of like purposely put these restrictions on yourself because you thought you were doing something good.
Yeah. And the biggest depleter of magnesium is stress. And I mean, you diagnose with chronic kidney disease and all those sort of things. And we know that a big stressful event can precede elevated blood pressure. We know stress makes blood pressure worse. And that's one of the reasons why, is because it depletes magnesium. And as you mentioned, our soils are depleted. We're not getting enough in our foods, just the farming practices and the way that, because magnesium is really high in a lot of our whole grains and nuts and seeds and things like that. And the way that it's processed, magnesium is really easily destroyed. So, you're working against stress there as well. So no wonder that's why we're so magnesium deficient. It's, yeah. And it's a vasodilator, as you mentioned. So it relaxes blood vessels. So we need it to bring down blood pressure.
Yeah. So, I mean, really like the simple takeaway here, not to overcomplicate this, but for me, when I look at patients clinically, number one, like I'm just looking through the data, I'm like, oh, they don't really have enough potassium. Pretty typical. Most people don't. If our labs are okay on potassium, and they're struggling with their blood pressure, or they're on like a whole bunch of blood pressure meds, it's a great idea to add in potassium on a dietary source, or even try doing some supplemental potassium. Potassium citrate can work really good because it's not only alkalinizing with a citrate, and potassium is an alkalizing mineral, but it also boosts all of that up to bring down the blood pressure. So that can be almost like, to me, that's like first line, right? If you're acidotic and you got some crazy blood pressure, if you don't have any potassium risk, let's start with just add some potassium in. And if you find that doesn't really budge anything, then you can add in a little bit of magnesium, where you start with a little bit of magnesium, magnesium citrate, magnesium glycinate. And sometimes you'll see that that will improve enough because now you start uptaking what potassium you have in. But I would say almost most of the time you're going to have to use both. And if you're using very, very high amounts of potassium, I was telling you, I had one patient who he drinks like 2 quarts of coconut water a day. So he takes in like, I just looked at his log today with that and supplements, he's probably taking like 8,500 milligrams of potassium. And one of my clinicians like, I think he's probably magnesium deficient if he needs that much to bring down his blood pressure. Sure, and she's right? And so if you're seeing you need a lot of potassium to make a difference, you probably need a little bit of magnesium as well. So,
Yeah.
I mean, it's simple. They're both inexpensive supplements, run them past your clinician, of course. But try those two simple minerals before you add on excessive amounts of blood pressure meds, because they have benefits on alkalinization and blood pressure.
Yeah. And if you haven't watched, Jess and I have done 2 or 3 previous podcasts about the importance of potassium. And just to quickly, as a high-level overcap, the studies do show that the ATAGI guidelines actually changed around potassium and kidney disease a couple of years ago anyway. Yeah. Number one. Number two, we know that if you take potassium out and you go on low potassium diets when it's not indicated by bloods, and now we know the bloods may actually, in some people, be indicating a potassium deficiency and a magnesium deficiency, you actually accelerate the risk of end-stage renal disease by taking it out. So a lot of these low potassium guidelines that some renal dietitians and nephrologists are pushing are actually accelerating the course of the disease. So you really need to make sure you're working with someone that understands that this is now quite old information. The science has really picked up. And number two, as you mentioned, Jess, like if you have to use really high levels of potassium, make sure you're pairing it with magnesium. But both the cases of your patients where they added it in, their blood pressure where nothing else worked went normal, right?
Yeah, it improved it dramatically, right? That's like after doing everything else. So I just keep thinking about that. I was like, wow, I wonder how many patients I've even missed that on, where I'm like, we did everything and like you try and cut back on the sodium. And I have people that are like, I eat any more than 500 milligrams of sodium, my blood pressure goes up. I was like, that just can't be right. Right. And, if you have to stay so low on sodium to control your blood pressure, you're probably missing the other two friends, right? A little bit of potassium, a little bit of magnesium.
Yeah, they all work together. And I think and it's funny because I did a podcast with Dr. Rick Cohen about this, where we're talking about, we're so dependent on labs to give us information. So we were talking about iron, where, if you've got low iron, you're anemic. He's like, no, it's sitting inside the tissue. And so it's sitting, you don't see it in the blood. It's just been pulled inside the tissue and it's oxidating. Yeah. Same thing with the potassium, right? When we see a spill of potassium into the urine, we go, well, we've got excessive potassium, that, as you mentioned, and in some cases it is a medical emergency. I don't want to take that away, that hyperkalemia can be an issue if that's really what's going on. But in kidney disease, where we're seeing a small spill of slightly elevated potassium, which is a very common marker, you can see that go back to normal, which I see in my patients all the time. When you add magnesium and you don't put them on a potassium-restricted diet, you keep up the greens to keep them alkalizing. That will fix the spillover because the potassium isn't inside the cells. It can't be drawn in, so it's spilling. So it's not that it's a potassium excess. It's like the potassium isn't moving inside the cells. And I think we need to be very careful about not getting black and white and dogmatic about our blood tests, because the human body is amazing in the way that it regulates itself. And
so true.
A urine test and a blood test isn't showing what's inside the tissue. And we need far more complex tests that we can't do to actually see where we can't take a cell out and find out how much potassium's in there. I think it's very important to know that blood tests have their limitations. And that the body's far more complicated than a straight blood test. So I guess the takeaway, Jess, what's the takeaway with this that you want to?
The takeaway is you're struggling with your blood pressure. Struggling with your blood pressure, and like if your potassium is high on your labs, just like work with a medical professional, because you got to piece out a couple things, and you want to be good on how you're monitoring with increasing potassium. So this is for people who have a normal potassium level. If you have a normal potassium level and your blood pressure, you struggle to just get it back down to that normal level, it would be prudent of you to look at how much potassium am I eating and how much magnesium am I getting. And if you're not getting enough, right, potassium upwards of 3,500 milligrams or even more than that, but like minimum 3,500 milligrams, I think a supplement is such a cheap, easy way to test it out. Like even for a week, right? Add in, 400 milligrams of magnesium, add in, 1,000 milligrams of potassium and see what happens, right? Because you may see, and test your blood pressure, you may see that those things will start shifting for you.
Yeah. And I will add that if you've got potassium in the urine, so it is slightly elevated and you're cautious about adding in more potassium and things like that, just add in some magnesium. It's the carrier. And if you suddenly see your potassium go down, It wasn't that you were, and this is if you've got a normal blood cell magnesium, which I've maybe seen elevated magnesium once in a very end stage renal disease. They were on dialysis and they were flushing magnesium through the dialysis machine. That's why. In fact, it's something I rarely see.
Yeah.
But you could try magnesium if you don't want to touch the potassium, because magnesium will carry that potassium back in, and without doing anything and changing your potassium intake, your potassium will disappear out of the urine. And it should do it quite quickly. So yeah, simple things to try. And you're using minerals, you're not having to take pharmaceuticals, which of course have got a whole pile of side effects. I think that's it, right? Nice and simple. Hey, Jess.
Simple, quick, easy, a little tip to have you noodle on a little bit. And we hope this is helpful for someone, and definitely, of course, run things by your clinicians that you're working with, but something to look into.
Yeah, absolutely. If you want to know more about what Jess and her team do, I'll put the link in below. You can find them at kni.org. Yeah, that's right. Kidney
Kidneynutritioninstitute.org. Yeah.
I always shorten it on you. They've got an amazing team of renal dietitians. They work with anyone in the US and also all over the world because of the amazing invention of things like Zoom. So I'll put Jess's details in there if you want to work with a really qualified practitioner who I highly trust, that is educated in the nuances of things like this and the new science. If you want to know more about what we do, you can head to www.kidneycoach.com. You'll find us on Instagram and on Facebook with the same sort of thing. And make sure you hit subscribe and like it. That way you'll get notified anytime we put up new videos. And if there's anything you want Jess and I to talk about, put it in the comments below and we'll make sure to do a video about it next time. Thanks for being part of our community. And Jess, thanks for your time, your knowledge, and your expertise.
Thank you, Fiona.
No worries. Bye.
Bye.